Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on investigations for physiological neonatal jaundice. The most common one is photometry. With the photometer, you can measure the approximate amount of bilirubin present in your blood, but not accurately. If you want to do that accurately, there is an invasive procedure where you draw the blood from the kid and send it to the lab, where you can measure total bilirubin, direct bilirubin, and indirect bilirubin. This has to be repeated multiple times. Maybe it has to be repeated sometimes every 6 hours in serious cases, normally in 12 hours or normally 24 hours. So it is up to the discretion of the pediatrician or the treating doctor. So this is the accurate method than photometer. Coming to the anatomy and histology, you need to know something about normalcy in a kid, how the normal liver functions, how the normal brain functions. See, when the neonate is born on the first day or second day, all his organs are immature. His liver is immature, not able to function up to the mark. His spleen is immature, and also his brain is immature. His urinary system, where you get urine, is also immature, and also the gastrointestinal tract, where there will be less motility, low amount of waves or low movement in the gastrointestinal system. Because of this, all this toxic material get accumulated in the blood. It is mainly due to the immaturity of systems and also parts of the neonate. Coming to the physiology related to neonatal jaundice, it is very important for you to know the physiology or normal function and structure of all these physiological functions. Normally, in children, what happens is when the children are in a closed environment in the womb, they will not have access to the oxygen directly. Their lungs is not filled with the oxygen. But what they have to do is they have to get the oxygen from the mother's blood. Blood of the fetus should be more efficiently taking oxygen from the mother. For that reason, it develops more RBC. Fetal blood has more RBC or red blood corpuscles than compared to the mother's blood, so that it can efficiently take the oxygen from the mother's blood. It can give it to its own tissues. That's the reason fetal RBC is more than the mother RBC. Next thing is, normally in adult, the lifespan of RBC is 120 days, but in kids or neonates or fetal RBC, the lifespan is only 90 days. After 90 days, it will be destroyed. After 90 days, what happens is this RBC will be destroyed in the spleen or reticuloendothelial system, where from this RBC, hemoglobin is released. Hemoglobin again has two parts, one is heme and one is globin. This heme is highly toxic, it is insoluble in water, it is red in color. What this endoreticulothelial system or the spleen does is it will convert heme into biliverdin. Biliverdin is a green color pigment, it is highly toxic and also it is insoluble in water. After that, spleen again converts this biliverdin into bilirubin, which is less toxic and it is also insoluble in water. Once it is converted into bilirubin, it comes out of the reticuloendothelial system or spleen and it attaches itself with the plasma proteins. Once it attaches with the plasma proteins, it is carried to the liver. It is carried to the liver of the mother in the baby. So what happens here is mother's liver is responsible for eliminating this toxic material from mother's urine and mother's stool. It comes out. But what happens immediately after the birth of the kid? When the kid is born, it is completely separated from its mother. As the baby's liver is immature, it doesn't have all the enzymes required to survive itself. So there will be a problem here. The problem is the unconjugated bilirubin has to be conjugated by liver so that it becomes less toxic and water soluble, and it has to be eliminated from urine and stool of the kid. In newborn babies, the unconjugated bilirubin starts rising from second day or third day. It goes to peak on fifth day or sixth day. Within 14 days, it becomes normal. You have to simply remember that liver is immature. That's the reason it cannot eliminate the toxins out of the body. That's the reason these toxins get accumulated in the blood, and this is taken up by the skin and eyes. That's the reason you see yellowness in the newborn baby.
Fidicus Homeopathy.